its application in health and diseases should be emphasized in medical education while we are talking about the biochemistry. She is an international grant recipient as a faculty, supervisor, and principal investigation for various student projects related to medical education and biochemistry. She has been featured in Erudite Women's Outstanding Contribution in Indian Medical Education Global J of Medical Research in the year 2021. Besides that, she has been an author more than 5 books. I will name and list few of them. One is she will be talking about that book today on this session, that is Textbook of Biochemistry. Another is the clinical case discussions in biochemistry, totally based on CBME education, CBME pattern. And another one is practical book of biochemistry for medical undergraduates, totally based on CBME, and review of biochemistry for CBME from C. All the books have been. Another one to name it is Concepts in Biochemistry with Clinical Approach, because she has been talking more on clinical approach in all her medical education programs. So all her books will be duly integrated to and mapped well with the subjects which are to be integrated well with the biochemistry. She is also a South Asian editor for Lippincott Illustrated Series, that is Cell and Molecular Biology, that is Southeast edition, May 2022. She's actively involved in research, and her area of interest are diabetes and its complications, thyroid disorders and its implications in various illnesses, vitamin D and its multiple role in health and diseases. This is a few line I have talked about Dr. Poonam Agrawal. She is a big stature in her own way in medical education and particularly in biochemistry. Now, I would request my co-host, Ms. Daljit, to kindly present the code of conduct before we share the dice with Dr. Poonam Agrawal, the speaker of the day. Thank you.
Thank you, Anu ma'am. And hello, everyone. The code of conduct is as follows. All the participants may kindly keep their speakers' mics mute during the session. If anyone has any query during the session, kindly raise your hands or message in the chat box, and the moderator will address your query. And for the question answer session, all the participants can put their questions in the chat box, which the moderator will take up later during the question answer sessions. And a special attraction is there for the attendees. 3 winners will get a free book who participates the entire event, free access to ebooks at EduPort for 7 days, 35% discount on the book by Dr. Padmaraj Udaykumar, e-certificate for all the attendees. We shall be sharing the Google form at the end of the session. Kindly share your experience through the same. And that's over. Over to Anu ma'am. Thank you.
Thank you, Daljit, for presenting the code of conduct. It is very important because once we are in a very important and scientific session, which needs to be delivered properly to the target audience. So I would request now Dr. Poonam Agrawal to kindly start with your scientific session, ma'am. Thank you very much again.
Thank you, ma'am. Thank you, Ms. Anu and Ms. Daljit, for kind introduction and code of conduct. Now, this is a great opportunity. You have given me this platform to talk about my book, which is actually my dream child. And I started working on this book in 2019, later part of 2019, soon after the latest curriculum CBME was proposed by the NMC. I started working on this book because I felt the need of a unique book in biochemistry, which will cover all the competencies prescribed by NMC and can give those competency in a very illustrative, easy and interesting manner. So with that attempt, I have drafted this book, which is in front of you. And I'm very thankful to all the participants who have taken their time out to attend this session. where I'll be talking about my the unique things about my book, which I have tried to cover in this book. So first of all, the question arises why I wanted to write this book. When already there are so many books written by great authors, then why I need to pitch into the task of writing a textbook, which otherwise is a big task. So the question why I decided to write this, I was very hesitant, but CBS team was so confident, and they were after me that, ma'am, you must pen down a book, textbook, which will cover all the competencies. So when I gave a thought to this, I understood that there is certainly a need of the textbook for the medical students, which will give them the insight into the subject, which is completely clinical. So with that thought, I started writing the chapters, and I started understanding, yes, that this is quite a possible task and can be done. So if I talk to you regarding the key points of this textbook of biochemistry with clinical correlation and case studies by Poonam Agrawal, this book is, as I told you, this book is totally competency-based medical education. Topics are included in this, and all the competencies prescribed by NMC is totally covered. And each chapter, when you see, it's beginning with the exact competency which is prescribed by NMC. And after that competency, I will be showing you in pages also. After that competency, the SLO has been decided. Specific learning objectives have been decided. And after that, the topic description starts. And topic description, I have focused upon the clinical connection of the topics. But at the same time, I have taken care that not to miss out any basic of the topic or any important aspect of the topic, even if it is not clinically correlated. So I have done sort of work here where a topic is completely modulated in a fashion which the first year student, medical student, finds interesting to read and learn and retain. So you will be, it's my request to all the faculties, all the honorable faculties here, to go through this book and see the chapters. You will be finding it a totally innovative approach. And and when you see, all relevant clinical and practical implications are described simultaneously. I will be showing you in the book pages that after description of the topic, I have taken the clinical cases and the practical implications. It's at that same point, so that the learner who is learning the sort of tough subject, biochemistry, totally understand why, as a first year medical student, he or she is supposed to read that topic, because he immediately gets the clinical connection of the practical implication of the topic. So he or she understands, yes, this topic is very important and we need to know this as a future doctors. So previously, I always felt that students are not liking the subject of biochemistry. They feel that it is biology and chemistry, that is it, and that they already have done in their 12th standard. So they simply don't pay attention to the biochemistry, and at the last moment, just a month before the examination, they pick up the book just to learn something and write it down in the exam without understanding the the connect of that topic with the clinical scenarios. So to break this monotony and to give the greater input to the learners, I have revised the topic completely in an easy language and in a clinically connected fashion, which makes the student, the top student or learner, keen to learn that topic. They are attracted to the topic because they know it has got something to do with the patient. Now, if you see, if we keep connecting the topics of biochemistry with clinical cases, the learner will be retaining it better. They say it is very volatile. I discussed this matter with many of the students before I started this project, and I just asked them, what is your difficulty in learning the biochemistry? Why you do not like the biochemistry? They said, Madam, seniors told that you read this subject only at the last month. just nearing the exam, because earlier you learn, you will forget it completely. It's a volatile subject. So it is very important that when we teach the students the subject biochemistry, especially the medical students, they need to be explained the importance of this topic in a clinical scenario. So in between, I have incorporated number of clinical cases which are relevant to those topics. And I have presented the case and then their description, their explanation based on biochemical metabolism. Then summary of the chapter is given for quick revision. And most important point is, now we are talking about next one and next two. In next one, and at the end of final year, they'll be appearing for the next one where all integrated questions will be asked to them. I feel this book is apt for the first year learner to learn so that they can implement these knowledges in their clinical cases, and they'll be more prepared to appear in the next one examination. I have given a lot of questions also, long answer questions, short answer questions, case-based questions, and multiple choice questions, because nowadays, as per new curriculum of NMC, we have all these 4 varieties of questions coming in the question paper. Some four years back, there was no place for the case-based question and MCQs. It was not mandatory. But now it is mandatory. CBQ and MCQ, they are mandatory in each university question paper. Previously, some universities used to incorporate the MCQs, and some were at their desire. If they didn't want to incorporate the MCQs, they were not incorporating. And as far as case-based questions are concerned, none of the university were making the cases and were asking the question in first year biochemistry. So nowadays, as NMC has advised us to draft the question paper, including 4 variety of questions: long answer, short answer, case-based, and multiple choice questions. I have given plenty of the questions in this book, which will help the learner to understand that how they will be writing the answers. And the beauty of the book is that MCQs are explained very well, in depth. They have been explained. Each MCQ is explained. Each option is explained in that if this is the answer, then if this option is the answer, then why this is the answer, and why not other options are answer. That is how each MCQ is dealt in detail. And a lot of diagrams, table, and flow charts are all given. So with this, this is the overview of my book. And now I would like to take you to the journey of my book. This is my book. If you see, it is sort of having a total 692 pages. And I have covered all the topics. All the topics means that you must be seeing that the book, all the organ function test, all the metabolism, the genetics, these are the topics. Like, they are divided into sections: cell, organelle, and enzymes. These are basic introductions. Then you have chemistry of carbohydrate, amino acid, and lipid. Then plasma membrane, I'm talking. Then I'm coming to the metabolism, where each metabolism is discussed in good detail. Then TCA cycle, then nutrition and micronutrients, organ function test, nucleotide, polynucleotides, where I've described all the metabolism of nucleotides. Starting with the basic chemistry, I've gone to the metabolism. And when they make you DNA and RNA, then I start talking to you about nucleic acid, how the DNA replicates, how the transcription is taking place, how the translation is taking place. Then after that, the various technologies in genetics, like you all must be teaching you students the RFLP, the blotting techniques. Each technique is described one by one. Then heme metabolism, free radical. So metabolism and lifestyle disorder like acid-base disorder, diabetes, obesity, everything is discussed. And one chapter on lab instrumentation and biomedical waste is also added towards the end, because this is the need of all students must know about the biomedical waste management and common laboratory instruments usage. And along with that, I've given certain sample question paper also, which will help students to practice. Right. Now, all the competencies which are prescribed by NMC is given on few pages initially. And which particular chapter and which particular pages these competencies are being dealt with, that is also enumerated in initial prelim pages of the book. which will make it a lot easier for the learners to go directly to that chapter and that particular page to learn that competency. Then after that, I will just come to, a particular chapter. I will try to show you how it is like planned. See, this is the chapter number 1, which is talking to you about a cell and its various organelle. So how this book is different from other books. For example, if you talk about mitochondria, I'm not just talking about the mitochondria where I'm talking about its size, its shape, its outer inner membrane, its mitochondrial DNA, its a function, how the outer membrane is.
Ma'am, excuse me, ma'am. Are you sharing
please.
it? Are you sharing the screen or you are just reading it out?
No, I'm sharing the screen.
No, ma'am, we are not able to see that. Kindly share it.
The PowerPoint is also not shown. I'm so sorry. Okay, so I'm so sorry. I think PowerPoint also I didn't share, but it's all right. I had made PowerPoints to enumerate all the highlights of the book. But now I'm just talking to you, right, regarding the chapter 1. I was talking to you about various, do you want me to show again all
Ma'am,
the...
you should showcase the presentation also. Yes,
right, all right. I'm just... I'm so sorry, participants. See, like, I'm not very used to Zoom meetings. I use other platforms, so I was a bit... Okay, all right. So when I'm talking to you about the contents of biochemistry, I have covered all the topics like cell and organelle. Then in that, I have discussed the enzyme also at one aspect. Then chemistry of carbohydrate, amino acid, and lipids I have discussed. After that, like plasma membrane, proteins, and extracellular matrix, where collagen and all, everything is being discussed. Then metabolism of carbohydrates, where various pathways, which like we talk about glycolysis, HMP pathway, glycogen metabolism, everything one by one is being discussed. Then metabolism of lipid, amino acids, all the topics are completely covered. TCA cycle, ETC, electron transport chain, then nutrition, micronutrients, organ function test, nucleotides, polynucleotides, the various nucleotides. When I'm talking about the metabolism, then the transcription, translation related facts, then genetic techniques, various technologies I've discussed one by one, heme metabolism, free radicals, lifestyle disorder, acid-base disorder, diabetes, obesity. So exhaustive list of chapters are there, and lab instrument and biomedical based management are also included. Sample question papers are also included. A lot of MCQs are there for the revision and practice. Along with the chapters, as well as towards the end, I have taken approximately sort of 44 pages of MCQs and its explanation. Right, and these are index of competencies which are enumerated in initial pages, and this is the chapter where this competency number BI 2.3 is given. This is the page number where exactly this particular competency is being described, like describe and explain the basic principle of enzyme activity, exactly just to nail it immediately. I've just enumerated all the competencies and their respective chapters and pages. Now, I would like to directly come to one chapter and show you how the topics are organized. Like, for example, this is chapter 1, and this is page number 25 of the textbook, where I'm talking to you about various organelles in the eukaryotic cell, like nucleus, like mitochondria. So mitochondria, detailed description regarding the mitochondria, its size, shape, function, organization, it's a DNA. After talking all these things, what I have done, I've taken the cases like what all inherited disorders are related to the mitochondrial DNA mutation I have described. And like, for example, there is a section of clinical correlation where I talk about the Leber's hereditary optic neuropathy, MERF, then MLRs, all these things, these are clinical correlation thing, and then cases. This is Mela's case, how the baby will be presenting. You can see 14-year-old girl presenting with headache, vomiting, weakness, fatigue. This is the presentation of metabolic mitochondrial encephalopathy, lactic acidosis, and stroke. Then after giving the case presentation, I have asked certain questions like what may be the diagnosis in this case. So I have given the explanation so that the student understand how a patient of MELAS will be presenting with. Then which all complexes of ETC are affected in various mutation of mitochondrial DNA. I want learner to understand that mitochondrial DNA is very, very important for exact functioning of electron transport chain. So what all proteins in the electron transport chain are due to mitochondrial DNA transcription and translation, how their mutation is going to affect the electron transport chain. So this is how Leber's hereditary optic neuropathy is another case which I have presented, like 23-year-old male is presenting with sudden onset blindness in both eyes for past 1 week. So a student, they understand what is this sort of problem the patient come across when patient is suffering with LHON. And then I have described the LHON question-wise. I have tried to explain the disease scenario. And along with that, I have tried explaining the biochemical aspect of LHON. Right. So this is how it has been approached for all the organelles. Like, for example, when you're talking about peroxisome, I have started talking about Zellweger syndrome after talking the basic introduction of peroxisome. When I talk about lysosome, I have told the learners that what is lysosome, how the hydrolyses are all there. Then the clinical connect, the eye cell disease. In that, one very important point, like the mutation is at what level. I have explained it very well here. Like N-acetyl glucosamine phosphotransferase mutation is actually responsible for eye cell disease, how the histological picture of inclusion disease, how the baby will look like. So I have tried to summarize all the clinical aspect of the particular topic. Same fashion, when I just show you regarding, say, for example, I take page number 153. Suppose if I take page number 153, it is talking about the extracellular matrix. I'm just showing you the glimpse how in this chapter I have dealt with the extracellular matrix material. I have told all the important major classes of biomolecules which are there in extracellular matrix. They are proteins, they are specialized proteins, they are proteoglycans, and then I have started talking about them one by one. Like, for example, when I'm talking about the collagen, I started from the basics, that what is collagen, one polypeptide, how many amino acids are all there, how the 3 chains of collagen polypeptides are arranged in the alpha chain form. So those things, after talking those important things, I start about the types of the collagen, how the collagen is being synthesized within the cell, how it is being secreted from the cell, everything in a illustrative manner I have tried to explain. This is a very unique diagram where I have tried to explain the learner in an easy fashion how the rough endoplasmic reticulum is involved in making of collagen and how in the Golgi apparatus that collagen polypeptide is getting modified. And then from the cell to the extracellular space, what is the structural changes which is taking place in the collagen till the formation of collagen fibril. So this is a very simplified line diagram which always a student can redraw in the exam. So that way I have discussed them. And the disorder related to collagen metabolism, I have collected all of them: the scurvy, the Ehlers-Danlos syndrome, osteogenesis imperfecta, Minky disease, epidermolysis bullosa, and Alpus syndrome. And what I have done after this, I have started talking about the scurvy, the brief introduction of scurvy, and then a case presentation of scurvy, how the patient will be presenting with the scurvy. This case 11.1, you can see it's a scurvy case in the adult, and the patient is presenting with bleeding gums, petechial hemorrhages in the skin. So first year students automatically understand the importance of learning the collagen in the first year biochemistry. Because once this case is being discussed, they understand when they sit in clinic, the patient of scurvy coming to him or her, they understand it's a scurvy and what is the basic problem. Once they understand the collagen architecture, they understand the importance of vitamin C, right? So this is how I have approached Ehlers-Danlos syndrome. Also, I have presented, and these cases direct can come to them as an case-based question, right? So how the hyperextensibility of the fingers in Ehlers-Danlos syndrome is seen I have given a picture. There's no harm in giving a picture. Nowadays, we are talking about early clinical exposure to the medical students. Early clinical exposure doesn't mean that we take the learners to the hospital and ward rounds and show them the patients. Early clinical exposure simply means that we give the clinical flavor to our subject in first year and second year. Right. So this has all been discussed. And next, if I talk to you regarding a sort of another one pathway, that is HMP shunt pathway, I take page number. Right. This is the HMP shunt pathway. Before that, I have discussed the glycogen storage disorder. You see how clinically it has been described. This is the glycogen. I started talking first about the glycogen metabolism, where I told what is the normal architecture of the glycogen, how it is different from the starch. Then what is glycogen in? Then I start talking about the synthesis of glycogen, all the steps in synthesis of glycogen, diagrammatically explained. And then how the breakdown takes place. In a simple line diagram, I try to explain the need for inorganic phosphate for glycogen breakdown so that the student understand, yes, we need inorganic phosphate for glycogen breakdown. If the inorganic phosphate are deficient in certain conditions where the ATP is involved in conversion of fructose to fructose 1-phosphate or galactose to galactose 1-phosphate, lack of ATP, lack of inorganic phosphate results in lack of glycogenolysis, and the baby is going to present with hypoglycemia. So until we emphasize on certain aspects of the biochemical pathway, we cannot make the student understand the complex biochemistry and its clinical connection. So if you just see, I've highlighted inorganic phosphate in red color. It means that I'm trying to emphasize this point that glycogen breakdown needs inorganic phosphate. In case of deficiency of inorganic phosphate, glycogen will not break and the baby may present with hypoglycemic episode. So I have taken due precaution in drawing the flow charts for each and every metabolic pathway. So after describing all the regulation and everything, now this is the piece of interest, that is glycogen storage disorder. Why the learner, first year learner, student who is going to become a doctor, future doctor, need to know about the glycogen metabolism, because he need to identify the babies who are coming to his or her clinic with glycogen storage disorder. So after describing various types of glycogen storage disorder in a tabular form, I started talking about the cases, how they will be presenting. I have not wasted pages or effort in writing down the whole description of Von-Gerke disease in gray and white. I just summarized all the glycogen storage disorder in a tabular form, and then I took each and every glycogen storage disorder, started presenting their presentation and relevant questions. You know, when the learner, they learn these questions, they'll be interested to know more about the glycogen metabolism. Pompe disease, I started talking about the case, how the case will be presenting. Then with certain beautiful colored pictures, I have tried to make it a little interesting for them to learn. Various types of Pompe's has been described: adult, infantile, juvenile onset Pompe's. Then Cory's disease, how it will be presenting, what will be the histological picture, what will be the variation in the structure of the glycogen. I have tried to explain here. So this is how I have just covered it. And HMP shunt pathway, you see, one of my renowned teacher once said that's very difficult to incorporate all the steps of HMP shunt pathway on one page. So I took it as a challenge, and you see all the HMP shunt pathway steps neatly I have summarized on a single page so that learner understand it very well, how the metabolites are getting interconverted. Right, and after that, the clinical connection of HMP shunt pathway, where I talk about the hemolytic anemia due to G6PD deficiency. Then in and out of G6PD deficiency, I have discussed in what all conditions the G6PD deficiency will be precipitating, how the patient will be presenting, what precaution you need to take if you're suspecting G6PD deficiency. Right, so this is how I have summarized that particular case. Fava beans, when I was a student, when I used to read G6PD deficiency, every time I used to read, oh, because of excess consumption of fava beans. this G6PD deficiency is precipitated. So I just wanted to put a picture of fava beans so that learner easily identify what is a fava bean, and next time they are a little cautious explaining the patient that such beans should be avoided, right? So this is regarding the HMP shunt pathway. Now I would like to show you the MCQs which I have covered here in this book. For this, I need to go to this particular page. Now, this is the question bank. You see the long answer question, short answer, and a very short answer questions type. Then these are the MCQs. I have given n number of MCQs. These are all MCQs. And I have not given the answer and explanation immediately on that page because learner, they tend to get distracted and, they immediately refer the answer. They don't use their brain and they don't try to analyze the situation and answer the question. So I have given all the questions firsthand, and after that I have taken enough time and pages to explain each and every MCQ. Like this is the first MCQ. The answer for that is acetyl-CoA, then why acetyl-CoA is the answer I've explained. Like that, I've explained each and every MCQ so that the student, they are not just mugging up the MCQ. That's a very wrong attitude. When they do the MCQ, they really need to know about the pathways and the concepts involved in solving those MCQs. So this was a sort of MCQ approach which I have taken. And if I show you another one page where I'm talking to you regarding carnitine shuttle. So it is not right if I just talk about the carnitine shuttle and move on. There are carnitine deficiency in certain conditions in preterm infants, as you know, the dialysis patient, in the liver failure conditions, in kidney failure conditions, there is a problem of deficiency of carnitine. So how those sorts of patients will be presenting to you? So for that, I have given a case study where I talk about, the carnitine deficiency and the associated problem. So in premature baby, how the carnitine deficiency will be presenting. It will be presenting with repeated hypoglycemia. Then I ask certain questions like, what is carnitine? Now students will be paying little more attention to the carnitine, that this is beta-hydroxy gamma trimethyl ammonium butyrate. Then by which condition you suspect the deficiency of carnitine may be there. So these conditions I have enumerated. Then role of carnitine in beta oxidation. So you understand that I'm trying to explain the students that carnitine is very, very important for fatty acid beta oxidation. And without carnitine, there will not be any fatty acid beta oxidation, and the baby or the person will be having the hypoglycemic episode. So this is how this approach I have taken in whole of the book, and wherever possible, wherever it is related to the clinical condition or the practical scenarios, I have made a case out of it and have presented it so that it makes the students understand, yes, they are going to be a doctor. Every time they used to ask me, ma'am, why are we studying biochemistry? We are going to be a doctor. Why we need to know all these metabolic pathways? They ask these questions only when they do not understand the importance of metabolic pathway. So this book, in a nutshell, is an effort to change this mindset of the learners and to make them understand the importance of this subject in the medical curriculum, right? So I really, yes, there are many questions, I guess. I will take certain questions and then I will proceed further. Can we get your whole book? As during promotion, some anonymous attendee is asking, can we get the PPT for whole book? As during promotion, we have shared PPT to faculties, but they're asking the whole book PPT. Overall, we are getting very positive response from. Thank you so much. And as far as the whole PPT is concerned, I will certainly try to make them, but I feel for a teacher, PPT is a very good resource material, and PPT will be valuable in the class only when the teacher who is going to take the session makes his or her own PPTs. But certainly I'm getting a lot of requests for the PPTs, and I'm in an, I'm making them, and some of them I have already made and have given to CBS team, and they are circulating it among the faculties. And if the faculties desire little more PPT from my end, I will certainly be doing that. Right. How can we get the PPT of this book? Okay, all right, the same question. Now, is it target height? Neha Prakash, I'm not getting your question. Please ask me again. Right. And all right, how we get to know who is the winner? Okay, that CBS team will be telling you. My best compliments to Dr. Poonam and CBS Publisher for success of this book. And madam has taken great effort and care. Okay, Dr. Sachin Parthakar, Associate Professor, TNMC, Mumbai. Thank you, Dr. Sachin. Thank you. Thanks a lot. I'm getting a lot of compliments from Pan India, and I'm very thankful to all the faculties for their kind gesture. And I'm getting a lot of good feedback, also good constructive criticism, how to improve this book in the next edition. Certainly, I'm jotting down all those opinions and suggestions, and in the next edition, I'll be incorporating those changes. Right. Any other question you can ask me?
Ma'am, there is a question how to use this book for my NEET PG.
All right. So this is a very good question. And may I know the phase in which a student is learning?
He's intern, ma'am.
His intern. Yes, so this is a very good question, and I feel this is the need of Orbita. See, during internship, you just need the targeted approach. For the NEET nowadays, if you see, all the questions, biochemistry questions, are clinically connected. You cannot go away by simply reading the old outdated material in biochemistry and go and attempt NEET questions. You have to go with the basic understanding of the pathway and its clinical connect, along with the MCQs, which is given at the end of the chapter. I think that will be a great help to you. If you follow this book, you will not make any question wrong in your NEET exam. And wish you all the best for that. Yeah.
There is another question from our student ambassador, CBS ambassador. Which section to be marked important for upcoming next exam?
Which section is to be marked important? See, all the sections which are incorporated in the book are as per latest guideline of NMC. CBME based questions are there, CBME based topics are incorporated, and all of them, believe me, are important. I cannot say out of these 700 pages book, I cannot say even one page is not important. So all the chapters, all the pathways are important, and it need to be learned by the medical student. Yes.
And there's a compliment from one of our CBS ambassadors from Nepal. She's Ayushma Kafle. She said, I have never felt biochemistry this interesting before.
It's a real compliment. Thank you so much. And when you read this book, you will really love this book, and your concept, your overlook of biochemistry will completely change. And I have a strong belief in this.
Ma'am, that was the reason basically I wanted, I would like to have further sessions with the students primarily now. After this was a faculty, focused on faculty session. But yes. The basic subjects like anatomy, biochemistry, and physiology, these are basic subjects, and students need to have the very basic foundation has to be very, very, very strong in terms of making them good professionals. So yes. I would ensure, and I would like all the participants to let us know which are the topics they want us to have the further deliberations for this webinar. They can share with us. We are sharing with you the feedback from anyways, but that will help us and Dr. Poonam Agrawal to let you know, to make your insight into the knowledge of biochemistry very fruitful for your own research, your own upliftment of the subject, and the making you the better professionals. I'm taking. Oh, there are people who are asking for complimentary copies. Okay, there's a question. Are there any key points mentioned where students should emphasize more?
Yes, it's like there in the book. If you see the chapter, I have written it like this is of importance, this is of clinical importance, this is a common case which you encounter in clinical scenario. That itself make the student understand that these are important topics and important aspects which should not be missed. So
I think the page number is visible, sir. You can see the key points have been shown by ma'am.
Yeah, the ketone body, if you see, there incidentally this page is open. The key points are there at the end. You see the whole chapter is summarized in just these 6 key points. So nearing exam, they can quickly revise these topics. And so this is how it is. And I was just trying to open some page like Indian scenario. If you see the micronutrients, they play a very, very important role. So I've taken a lot of time to draft the chapter on vitamins and minerals, and every vitamin is being dealt in detail. And along with the chemistry of vitamins, I have talked about various cases like beriberi. I have talked when I say alluron layer, I have showed the alluron layer also. What is the alluron layer in the cereal? So this is how like students will be understanding what is wet beriberi, what is dry beriberi. One is
and there's a question that can you explain the vitamin C helps in iron absorption?
Yeah, vitamin C very much helps in iron absorption because you want me to answer this question?
Yes, ma'am.
Yeah. See, we have DMT1, right? Divalent metal transporter 1 on the luminal side of the gastrointestinal cell. This dimetal DMT1, dimetal valent transporter 1 absorbs ferrous, not the ferric. And what we consume is actually released in the GIT lumen in the ferric form, 3+ form. So you need to reduce 3+ form to 2+ form, that is ferrous form. After that, only it will be absorbed by DMT1. So who is going to reduce the ferric to ferrous? It is duodenal cytochrome B reductase enzyme, which is going to reduce it. And this particular enzyme, duodenal cytochrome B reductase enzyme, needs vitamin C for its action. So that is how when we consume vitamin C, like lemon juice or orange juice, along with the food, what happens? The ferric of the gastrointestinal lumen is converted to ferrous, and that ferrous is easily absorbed into the GIT mucosa. So vitamin C helps in iron absorption, right?
Thank you, ma'am. Thank you for the great explanation. I think we have not any questions now left. I would request Mumbai team to kindly share the complimentary copy of ma'am's book with Dr. M.G. Dave, Professor and Head Department of Biochemistry, Government Medical College, Civil Hospital Campus, Usmanabad, Maharashtra. So you can kindly share the complimentary copy and talk about your book, our book in that college. Also share the features with the students as well as with the faculties. Anything else, ma'am, you want to like, anything you want to talk about the book? Like,
no, that is it, like, yeah. So I think I have told enough about the book. Its flavor of the book is different from other books. And see, for the medical student, I strongly believe the approach to the subject should be entirely different. We cannot teach the same biochemistry to the medical student to what we teach to the paramedicals, DMLT student or BSc nursing. Every subject is having their own requirement. Every syllabus is having their own requirement of this particular subject, and it should be taught in that fashion only. So that was my strong motivation. You know, when I felt the need of a book for the medical students exclusively, I thought of writing this book. And when I was just dreaming of writing this book in this fashion, the CBME was proposed. So me being a medical education coordinator, advanced course of medical education I have completed. So being a medical education specialist, I totally grabbed that opportunity and drafted this book accordingly. Thank you very much, all of you, for being so much.
Ma'am, there is a question from one of the attendees. What is the role of iron in thyroid hormone synthesis. What is the role of iron in thyroid hormone synthesis?
Thyroid hormone synthesis. Iron is not needed there. I just don't know from where this question is arising. Let me refer to this, and certainly you can mail me. I'll give you my mail ID. And the role of iron in thyroid hormone synthesis is little sort of, I'm not aware about it. I have to see literatures regarding this, and we'll give you the answer. We can have discussion on this.
There is one attendee from BSc Nursing. She's asking, ma'am, how this book can be helpful to BSc Nursing students and preparing for competitive exams.
Okay. So as far as nursing is concerned, see, nurses, they work hand in hand with the doctors. They also need to understand the cases. So this book is giving all the clinical conditions and its related biochemistry. So even for nursing student, I think this book is going to be very, very useful compared to the books which do not give you any clinical connection. This book is certainly give you the orientation to the cases, because our nursing officers, they are the first meeting agent in the hospital. When patients, they come, the first person who come across is the nursing officer. They see the patient, they make the history, they make the overall judgment of the patient. So for them also, it is very important if they understand the subject clinically. So I strongly believe that this subject for BSc nursing also will be very, very useful.
Ma'am, I think anyways, anatomy, biochemistry, and physiology are the basis of any healthcare segment. So I think all the students on all these healthcare segments should have a firm foundation of all these three subjects.
I totally agree with you, madam, because unless until you understand the clinical conditions and the metabolic error which is there in that, you cannot approach with the treatment of that patient. So for all healthcare specialties, I think this book is going to be a very, very good book for learning the biochemistry. So
there is one attendee who has liked your presentation and your entire talk of the day. She has complimented you. Very nice. Okay. I think, ma'am, we don't have any more questions now. And
somebody is raising hand, I guess.
She is the same person.
Okay.
Yes. Okay. There is one. How do you compare your book to Lippincott Illustrated Reviews by Biochemistry and Vasudevan Biochemistry?
I wanted somebody to ask me this question. I really wanted to, answer this question. This is a very, very important question. And at the start of my session, I said, I myself was confused why to write a book when already Lippincott is there. Now, when you have named it, Vasudevan is there, Satyanarayana is there. There are so many good authors who have written the book. But then, what happened long back, when a set of students came to me and they asked me, Madam, there are these topics which you asked me to read from this book. This particular topic you asked me to read from this book. This is the topic which you suggest you go and refer the Lippincott for this. So how can we read so many books at once? Then I said, beta, you have to do this if you want to get good marks, if you want to have a good doctor, want to become a good doctor, you have to refer many books. Then they said, Madam, be practical. In first year, we have such little time. How can we go to the library and refer various books for various topics and then make notes? Then I was like helpless. I said, then what should I do? It's a 4 years back when this happened with me. And I said, then what should I do? Then they said, Madam, you're a very good teacher. We really understand, love your teaching. Then why don't you write a textbook which incorporates everything which you feel is good at one place? So that was eye-opener, and I don't want to compare with any book.
Yes.
It's a unique attempt. It's a unique attempt where I have taken the best approach to a topic which I feel as a expert in the subject. So there is no comparison for anybody. Everybody is unique. Lippincott is unique in its own sense. Vasudevan is having its own quality. But my book, I feel it's unique in the sense when you read, you find it's very simple. When you read, you find it's, oh my God, it was like that. And when you sit in the exam, exact things will be asked to you in the exam. I have firm belief in this, that once you read this book, your scoring in the university exam will be very good. So this is from my end. Yeah.
Can I add something as a marketing person in this, that I want you people to understand that everyone has his own way of presenting the things.
Yes.
So this is how it varies from one book to another book.
True.
Right. So whichever way you are able to understand the things properly, that is where the expertise of the author comes into place.
True.
Right. So this time, ma'am has tried to put all the resources, what all the biochemistry needs right now, what all you need as a CBME pattern, that has been taken care thoroughly. At least I think ma'am has tried her best to give you all possible content which is required for any, maybe it's the UG, PG or any exams. I think the lots of case-based questions that is going to help you in integrating the mapping with other subjects you have with the biochemistry. That is going to help you understand the biochemistry in its own way. And you will be in a better position to have a clinical exposure at very early stage, which is required at, I mean, it's required as per CBME guidelines, right? So I also endorse, not because I'm a marketing person from a CBS, but yes, I think, and I have overread this book at my level also, that this is a very good book. And everybody who is present over here, or I would like all of you to have a word of mouth with all your students and the faculties regarding this book. This has come out very well. We have getting very, very good response across India. And she has been in teaching for all the 17 years. That is not a very less period. That's a very good period to come across to such kind of the experience and write a book. So I'm sure this is going to help you out. Thank you, ma'am. We are done with this session also. Now there is one Amit Kumar. He said, yes, this is a good knowledge which you have shared with the students. One student, he's ultimately every teacher aims to make students understand the concepts. I hope madam's book helps in this way. Now there is one more person, Drupal Prajapati. He says that I think this book is a game changer for nursing students and medicos. It's primarily written for medicos, and this can be helpful to this nursing and other healthcare people also. It depends how much they want to read. But for the medical primary, it has been written, but it includes all the healthcare segment, whatever they want to have, they can have from this. Everything has been included in this.
Can I ask one question?
Yes.
See, now this PPT is given for 95 pages. Can it possible to give for the full book? Because wherever we are going, they are asking the same thing. One book. Hello? Are you hearing me?
Yeah,
Dr.
you're audible. Yeah, I can hear. Please tell.
No, ma'am, where this book has been given and this PPT is for 95 pages, na? They are asking for the full book. Is it possible?
I'm sorry for I didn't get your question. Please ask again.
Hello?
Yeah, please ask again.
See, this PPT is given for 95 pages only at present.
Okay.
But they are asking for the full book. Is it possible?
Yeah, that is what I said. I am trying to make the PowerPoint presentation for all the chapters, and soon you will be getting.
Okay, thank you.
There is a comment from Pratibha Agrawal. For concepts, I recommend my juniors to go through this book. She is, I think she is a faculty, ma'am. She has recommended.
Thank you so much. Thank you so much. Yeah, and they will certainly love this book. That I assure you. Yeah.
Okay. No, since questions are coming, I every time say to you, let me close. But webinars and CBS Author Talks have been doing very well for last 1.5 years. So I request all of you to stay tuned with us for all upcoming webinars, CBS Author Talks. Do share with us your topics you want the webinars on. So, ma'am, I'm now on a last part of this session.
There is one more question from Mr. Hari. Does the book contain the practical part as well? This is again a very beautiful question, because see, all the practicals are certainly not covered in this book. For practicals, I have a separate book called Practical Biochemistry for MBBS. But yes, of course, like when I'm talking to you, talking in this book regarding the glucose as a reducing agent, I've taken that opportunity to discuss the Benedict test and its basic principle. Similarly, suppose if I'm talking about the diabetes, I have taken this opportunity to discuss the oral glucose tolerance test and various criteria to diagnose the diabetes and impaired glucose tolerance. So yes, partially I can say that practical aspect is also being covered here. But for complete practical as prescribed by CBME, you have to follow my practical book in biochemistry for MBBS student, which is in 2nd edition at present. That is also by CBS publication. Yeah. So thank you so much. Yeah.
Ma'am, I think we are now on the last session, that is closing the session. So I'll be putting my vote of thanks to the people who are here, and especially, ma'am, you taking your time from your busy schedule. And it was a wonderful session, I must say. I would request you to be like part of these sessions. And I want you also help, the students will be more, get more knowledge out of this once we have the integrated approach in the upcoming lectures. That is going to help them very well. And I'll ensure you that you will be getting hundreds of questions for upcoming author talks when we have that integrated approach.
It will be my pleasure. It will be my pleasure.
Yeah, I would request you should think upon that integrated approach type of lectures to be given.
Sure. We will plan it soon. I've been doing it in my medical college, the integrated approach with the pediatrics, with the physiology.
Yes.
Doing it, and on this forum also I would love to have an integrated session.
Thank you so much. Thank you. So I, Anu Rena, thank all of our valuable participants, esteemed guests, that they honored us with their presence in today's session and made this wonderful session possible. Your participation ensured the success of this event. Special thanks to Dr. Poonam Agrawal. Thank you, ma'am. Thank you very much for your time and from your position and educate our participants. It was, I must say that it was primarily like focused on the faculties, and I can see the faculties have put their questions across. There are lots of CBS ambassadors who were also there on the panel, like as a participant. Last but not the least, I would like to thank our CMD, Mr. Varun, Mr. Arjuna sir, Senior Vice President. I would like to thank my companion, co-host, Ms. Daljeet, for supporting me in the entire online session, the sales and marketing team of CBS Publishers and Distributors to promote this event. And I would also like to thank Neetu providing me all the online creatives on time. Special thanks to our student ambassadors. In the end, I would like to repeat that you are requested to stay tuned with us for all upcoming CBS author talks or any kind of medical education program. See, we have already started CME on anatomy. We will be doing it for biochemistry. We will be doing for other subjects as well. So stay tuned with us, stay connected with us online and offline, whatever is the best possible way to stay in touch with us. And I'll be thankful for you if you can like fill the feedback form, which will be shared with you very soon. So you can give us your experiences regarding the this webinar, so that we can manage the further upcoming webinars the way you want us to do that. So thank you once again. Thank you. Thank you, Dr. Poonam, for being here.
Thank you so much.
So much.
I would like to thank the whole CBS team for making such an effort and give me this golden opportunity to showcase my book. And I always wanted to tell about my book, and this was a very good platform where I could discuss the pros and cons. I don't accept that there is a cons, but yeah, if there are certain mistakes or certain deficiencies, you can always inform me. And I thank all the participants for taking out their time and giving such good feedback and for their questions. Thank you so much.
Thank you, ma'am. Thank you very much. Good evening and all the best to everyone. Thank you.
Thank you.
Thank you. There is a comment. Thank you so much, ma'am, for this informative session. Students would definitely reach great heights through your valuable guidance and mentorship. So everybody is happy today. I'm really, really happy for this session. Thank you, ma'am.
Thanks, Satan.
Thank you.